Hey, Joe Zarzaur here with Dr. Evan Malone to discuss all the vaccine information that we're hearing. I know over the last couple of weeks, we haven't done an update in at least 2 weeks now. Things have pretty much plateaued, I believe, locally. But the vaccine information that is coming in from all different directions seems to be confusing as heck. We know there was 2 vaccines that were and we've explained this in prior videos, that were the mRNA, am I saying that right? mRNA based mRNA based vaccines that were offered by, I believe, Pfizer and what's the other company, Dr. Malone? Moderna. And those are I think Moderna is the one that's actually here locally right now. I don't know about the Pfizer, but in any respects, we also went through in a prior video that the first candidates would be healthcare practitioners, long-term care facility patients and staff. And then I believe a couple weeks after the release of the vaccine, they went ahead and said, okay, everybody over 65 or 75 can get the vaccine. Now, then we heard that Publix was offering the vaccine. Then we heard that Olive Baptist Church has it, and the Milton Community Center had it. And now we're hearing some stories about Sam's and Walgreens. I guess that came out today. All right, not Sam's and Walgreens, Sam's and Walmart. So first of all, if you're local in Pensacola, surrounding counties, Santa Rosa County, Dr. Malone, tell us who can get the vaccine right now and where you get it.
So who is, like you said, it's healthcare providers with patient contact or and it doesn't have to be a doctor or a nurse. It can be, just off the top of my head, respiratory therapist. It can be a dietitian. It can be someone who is seeing patients or interacting with people who would be considered under their care in some capacity. And that right now is what Sacred Heart was offering at their clinics there, where you come up and show them your license and sign off your information, and you got put in the system. You got your first shot and you got an appointment for your second shot. The same with applying then for 65 and older, as you had mentioned. And that was appointment only through the Sacred Heart website. And those were, back when we did an update a couple weeks ago, they're popping up as fast as they're going away. And, I was refreshing and seeing, any given time there was between 10 and 100 different appointments. And this is both at their campus as well as at Olive Baptist Church.
All right, so wait a minute. So just answer this precise question. Where in Escambia County can they get the vaccine?
So Department of Health, Sacred Heart System, which is at their campus, or Olive Baptist, and then the Publix locations right now.
Okay.
That's
who can get the vaccines at those 3 places, general places in Escambia County?
By appointment, the healthcare workers and over 65.
Okay. Now, what about Santa Rosa County? Where can you get the vaccine and who can get it?
So that's through the Department of Health in Santa Rosa, and last I understood, they're doing it at that Milton Community Center as well, and that was part of the Sacred endeavor in Santa Rosa County.
And then
the Publix, yes, the Publix locations in the county there.
Do you know which ones? I know they're doing it in Gulf Breeze proper Publix. Do you know if the Tiger Point Publix has it, or any other Publix in Santa Rosa County offers the vaccine?
I believe it was, when I last looked, it was the Tiger Point one as well as the Navarre one that I saw, those 3 for sure.
All right, very good.
I don't know about the ones in the north part of the county.
And to get an appointment at those places for the vaccine right now, and what is it, February 3rd, you have to be over 65, and I think you have to be a Florida resident now, is that right?
Yes, and that's changed since the last video we did, where it was basically all comers. So it's a resident of the state primarily, and then of the county. They're trying to keep people in their counties, but I don't think that's a disqualifier to say I'm from Escambia County and I'm getting it in Santa Rosa or vice versa.
All right. Now, I saw something else this week that said they're allowing doctors to prescribe the vaccine for people with high risk, even if they're below 65. Explain that.
Yeah, so that's starting next week. Sacred Heart's going to start offering that. And so someone who falls in the category of high risk, and the list that was put out included immunocompromised state because of cancer, transplant history, diabetes, obesity with the BMI over 30, heart disease, CHF, coronary artery disease, and then lung disease. Those were the main ones. If you have those conditions and you're not 65, you're under 65, then I would advise now would be a time to be touching base with your doctor, because a note is going to be basically your ticket to get qualified for doing that. So a lot of physicians will have a letterhead ready to go. It's a 2-sentence thing saying, hey, this is my patient. They qualify with high-risk condition. They may elect to put your diagnoses on there or not, and they sign their name, their contact information's on there. And that's your note, because you will need to produce that along with, obviously, your proof of residency in the state.
All right. And if you qualify for, and you're under 65, and next week you qualify for one of those high-risk conditions, where can you get the vaccine at any place, or do you have to go to a certain place to get that vaccine?
So that's, in our area, the 2 facilities would be Sacred Heart Pensacola, and then Sacred Heart Bay Medical in Panama City. That's who's getting those doses for that particular part of the population.
Okay, all right.
So you'd be making a reservation or an appointment through the Sacred Heart system. And right now, when I go to the site, which I just did 2 minutes before this video, that option is not yet listed. It's to start on Monday the 8th. So I imagine that option would be on there, or you'd have a contact to get into that channel of how you're getting your vaccine.
Very good. Okay. So what else do we need to tell folks about the vaccine? What if somebody's everybody's hearing about these variants and thinking, oh, what if they're already on the fence about the vaccine? Then they hear some news story. Oh, there's a variant. I told y'all that this thing wasn't going to work, and we don't know enough about it. I'm not going to have it done. And then the discussion, the soundbite they hear about the variant makes them think, okay, well, maybe I shouldn't get the vaccine. What do you say to those people?
I would say get the vaccine either way, because if we're thinking that the vaccine is 95% effective in producing an antibody response in people when coming out of the studies, I would take that gamble and say, well, like, I got an antibody response to something that I may or may not have full immunity to if I happen to get a variant. Right now, all the studies show that the vaccines do have some impact or ability to work against these variants. To the same degree, maybe not so much, but it may make your infection with the variant not as extreme as the infection you would have without a vaccine on board.
And what about the argument that the more people that have the vaccine, the less capable the virus is of replicating and then mutating, right? So if the virus can't go from host to host or person to person because more people are vaccinated, it can't then mutate and become a worse virus. I mean, we could create the Pensacola variant, right? So yeah. It's important for us to put a stop to this thing. And the more people that get the vaccination, any degree of vaccination, even the first shot, that get the vaccine here locally, the better off we're all going to be locally. So yeah. Even though you're hearing things about South Carolina, the variants there, and the South African variant, I think started in South Carolina, now it's all over. I think we have some in Florida. And that's the one that they were most worried about. I think what you're saying is even the first dose of the vaccine is somewhat helpful with all the variants. So even though it may not prevent you from catching the virus, you'll have 2 days of like flu symptoms and then be done with it. So versus going to the hospital on a respirator.
Yeah, and one good way to think about this, Joe, is imagine you're playing a football game and you're one of the defensive players. You have a whole set of 11 guys coming at you. They all look different. One's a little bigger than the other. They all have different numbers on it, but it's the other team. You're going to defend against the other team no matter what's coming at you. These vaccines still provide some defense, okay? They might not tackle the exact one they need to tackle all the way, but it's going to do some defense. It's going to have some defense. So that's the easy way to think about it. So it's not like you're being benched
right.
with the
that's a good thing. What else do we want to offer today in this vaccination video?
So we have links as always, and we're gonna post those with the video very quickly. I will show this one. And for people who are not in the category of over 65 or not in the category of, hey, I'm about to, you know, I have a high risk condition, I would encourage you to go to the My Vaccine link that the state of Florida put out, and you click on your respective category, and then you get in line. And so if you're a 30-year-old who's otherwise healthy and you're thinking, well, I'm not going to get this shot till whenever, you can go to this and you do all the little drop downs and it will send you updates. If you're a 30-year-old who's healthy, it'll send you, hey, you're about to be getting your opportunity to get the shot, whether it's 2 weeks from now or 2 months from now. So the state is really pushing this, and it shows you the process that they go through. So to say, oh, it's frustrating, they can't schedule me an appointment, that's because they're getting orders every week. They get a 1-week order. And so it's that, it fluxes that quickly. So it's not like they have they can tell you what's going to be getting in March, okay? So I would encourage you to go to the link for the My Vaccine that state of Florida rolled out within the last week.
Yeah, everybody should do that. Get in line.
Yeah, and you know, at that time, when your turn comes up, whether it's 2 months from now, you asked me earlier, where can I get the shot in Escambia County? Instead of listing 3 places, I might be able to list 10, 10 different outlets. And that's how the idea of getting the 30-year-olds vaccinated that want it are going to be, you're going to Sam's to get yours, you're going to Walmart to get yours, because that's where the doses are available and you're up to bat.
All right. And if you've already had the virus, you may think you're bulletproof because you've been around people that just have the regular COVID-19 virus. But once you introduce all these variants, whether it's the UK variant or the South African variant or whatever variant we're talking about, my understanding is that even the antibodies you developed from having COVID-19 3 months ago, 4 months ago, 5 months ago, it's not going to put up a sufficient enough fight to ward off maybe the South African variant, and you're probably could potentially get sick again. Now, you may not be as sick as you were the first time, but you may get sick again. So, and nobody wants to go through that 2 times.
Yeah, so I would encourage you to get that. And to that, there have been a lot of questions about how if I got infected between dose 1 and dose 2, what should I do? Or right before I got my first dose, I realized I had contact with someone. So Publix actually has this on their site, and it's from the CDC's recommendations on recommending when you get vaccinated based on when you were infected or exposed. So it's a really easy breakdown, and we have the Publix link on the links today. So this is listed on there. The main thing is if you've been recently exposed or you're acutely ill, the idea of not getting a vaccine isn't because the vaccine doesn't work. It's because you're not supposed to be leaving your house anyhow.
Right.
So.
Okay. Or if you leave the house, you're supposed to have a mask.
Yeah.
All right. So this was Vaccination 101, I guess, for purposes of where we are now on February the 3rd, 2021. If you have questions about this video, you can find us on the web at zarzaurlaw.com, or you can call us at 855-HIRE-JOE. Again, thank you, Dr. Malone, for giving us all this information, and click on any of the links below if you want further study. Take care.